Hi everyone, welcome back to my channel, Let's Talk Money. So in one of our previous videos, we looked at how much an individual living in San Francisco would pay, a 40-year-old person living in San Francisco would pay for health insurance. And today I want to illustrate how much a family of 4 living in the Bay Area in Santa Clara County would pay. And again, this is for plans available in the covered California. And we'll assume that this family makes 100K per year. And again, it's a family of 4. I already did a little bit of estimates, and I've seen that there are plans as low as $36 a month. This is huge. So let's see. Okay, so we are going to run the quotes in the covered California. And again, this is an estimate, okay? Let's just say this is for 2019. Let's just say they live in Santa Clara County, and we'll go ahead and say they make $100,000 a year, and we have 4 people in household. So let's say that the father is 45, the mother is 40, for example, right? Let's say one child is 15, the other one is 10. Okay, let's see what we got. And we're going to go ahead and skip that. So as you can see right from the start, you can see the subsidy that is available for 2019 for this family. Again, the family of 4, the household income is $893, and I'm sorry, that's the subsidy. And yes, they're making 100K per year. And 100K is the income is considered adjusted gross income for this family. Okay, so let's just see what's available. As I said, there are rates as low as $36 a month. That's with the local VHP Valley Health Plan, and they're not bad. They have pretty good contracts this year with doctors, and as I understand, they're adding more and more doctors, which primarily have private practices, which is great. This is huge. And I think in this video I'll go ahead and compare just a few plans side by side, but let's see the premiums. So as you can see, as we go, the rates go up and up, right? So a Kaiser Gold plan would be $995. This one does not have a deductible. And then we have PPO plans, which are a bit more expensive, right? And Blue Shield has HMO plans here as well. Okay. So let's just go ahead and select 3 plans. I feel like I want to select the Blue Shield HMO just to compare it. Let's go back. I want to select a gold and a bronze plan so we can see side by side. Definitely I want to select this one because it's quite competitive. Their rates went down, I think about 11% or so for the bronze plan, so that's very attractive again. And then let's select a gold plan. I want to get, okay, let's get Kaiser Gold. And let's just compare, so we'll see side by side what the plans cover. So we are comparing a Valley Health plan, which is a bronze, the Kaiser Gold, and then we are comparing Blue Shield HMO plan. So the price-wise, you know, that's a difference, but also there's a difference because the coverage is, and then another thing I want to mention is you can search for a doctor, because in the past there was a big deal. I think Anthem Blue Cross messed up a lot. They didn't have any doctors available, so really they messed up big time, the whole thing. And I would say, it's my personal opinion, they basically screwed up the reputation of Covered California. So Covered California decided to put on that you can select a doctor at the time you are looking for a health plan. So You can do that if you want. And then back to the comparison, we'll look at the bronze, gold, and silver. Obviously, the plan design, the bronze plan is high deductible. Again, if you are young and healthy and rarely see the doctor, you don't really care about this huge deductible. You have your preventative for free anyways, one annual exam, and then you will have 3 more visits to the doctor that will not be subject to deductible. So that's huge as well, right? So if you are young and healthy, why would you want to pay this much or this much? You might think about saving money on health insurance. And yeah, there is a deductible, but again, if you have a peace of mind and you pay $36 a month, why would you care, right? So I highly advise, if you are not sure if you want health insurance or not, just get some basic just in case, because the beauty of having health insurance really is, what if something happens, right? What if, think of it as your house. What if your house burns down, right? Would you have $500,000 to build it up? No. Same thing with the health. What happens if there's like an emergency, something huge happens, surgery and so on? Would you have 50, 60, 100K or 200K to pay for the medical bills? No, you won't, right? Even with the lowest level plan like a bronze, your maximum out of pocket is $7,550. So what that means is, worst case scenario, you are hospitalized and you get a bill for $500,000. You don't care. That's what you pay, and then the rest is the problem of the insurance company, right? So this is huge. This is important. Yes, that's a lot of money, right? But that's all you pay. You don't have to go bankrupt. You don't have to sell your house and then ruin the whole family finances to pay for medical bills. Again, this is a great thing, peace of mind that you have. Anyways, too much for the bronze plan. Really, I want to say something about the gold and silver. So silver plan, it has a little deductible, but a lot of the clients that I talk to, they're scared about the deductible. They think that it works like in a car deductible. They have to pay this money before anything. No, not at all. The deductible doesn't apply if you go to the doctor, you pay $40 copay, that's it. If you do the labs, you don't pay the deductible at all. You start paying the deductible only in certain cases. And let's just take a look at that. Again, the gold plan is in the middle. It doesn't have a deductible, so we don't care about that. But since we are talking about the deductible, let's just take a look, right? Medication has a separate deductible that's less. We can talk about that later. But really, what I want to show now is when you start paying this deductible on a silver plan. And I'm talking specifically about silver right now. So here you see inpatient hospital services, right? That's when you start paying the deductible, when you're hospitalized. So far, we haven't seen anything about the deductible here, right? So silver is basically a good alternative. Now, I mentioned that there is a separate deductible for prescription drugs, right? And that's listed right here. That's $200 per year for individuals or $400 per family. That's nothing, right? It's very, very low. Another thing I want to mention is urgent care and emergency room. This is huge, and a lot of people end up paying a lot of money because they have no idea what they're doing when. So again, if there is nothing serious, do not go to emergency room, okay? Do not go to the emergency room if you have like a fever or have an ear infection or a stomach pain. Don't waste money. So with the bronze plan, you'll pay the whole thing, the whole bill, right? With the gold plan, you'll pay $325 for that visit, right? and then with the silver you'll pay $350. Instead, what you can do, you can go to urgent care. All right, this is huge. Even with the bronze plan, you pay $75 and you don't touch the deductible if you stay within the contract limits, right? With the gold plan, you pay $30, and with the silver, you pay $40. That's it. Again, don't go to the emergency room. Go to urgent care instead if there is nothing. If you can walk, talk, breathe, do not go to emergency room. You'll save yourself a lot of money and time, and you don't have to see all that stuff that's happening in the emergency room. Okay. So we talked about hospital, and there is like, you know, you can actually do a comparison and see for yourself what's available in your zip code. But again, the plans have a pretty good coverage, and for the children, it includes dental and vision as well, right? So I don't really want to go into very deep details because I have a video on my channel where I talk and compare all the plans side by side. So I don't really want to go into that. Really, I wanted to just kind of show that, you know, if you are a family of 4 living in Bay Area and making less than $100,000 a year, you should really consider looking at what your options are for health insurance bonus next year. As you can see, this family can save up to $893 a month. Again, this is huge. They are making $100K. You know, that's not a family. You know, that's a pretty decent salary, I would say. Even though some would argue that it's not enough to sustain, you know, for a family of 4 living in the Bay Area. But in any case, $100K is that's a lot of money. Anyways, that's all for today. Again, this is for illustration only. This is estimate, just giving my personal opinion on, you know, the plans and anything. I'm a broker. I work with anyone, every single insurance company that is open for business in California. So if you have questions, feel free to reach out, and I'll be glad to help. And then while talking, I also thought about dental plans because it's here, but we didn't talk about it. So let's just take a quick look at dental plans, right? So you can, and that's for 4 people, but the children might not need separate dental because their dental and vision is already included. So, you know, Delta Dental, you can get a HMO plan for $56 a month. Pretty good. If you want like a little bit, if you want a PPO plan, you can get the, you know what, let's just go ahead and compare just so we can see. Let's just get the one that's most expensive, you know, just so we can see what it is. So yeah, this is HMO and the other 2 are PPO, but really the only difference is the price and network of doctors. I think the benefits are pretty much the same, right? So there is no deductible in the HMO. You know, you can see all this good stuff, dental coverage. You can take a look. Again, I don't really want to go into details. I just wanted to give an overview, but since we are talking about dental, I'm showing the benefits as well. So here with dental is a little bit different. So HMO is cheap, but it doesn't have as many doctors in their network, and you might need to pay a little bit more when you have dental dental procedures, right? PPO is a bit more pricey, but it has a better network of doctors, and there are a bit of restrictions on this plan as well, since they have so basically what you want to keep in mind is that PPO plan has a limit of so in this case it's 1,500, and here's the coverage. Now, one thing about, and that's huge, that's very important, about dental plans that are available in the Covered California is that they basically negotiated. So instead of having 12 months waiting period that you can get on the private market, they only have 6 months waiting period for major services. And that's huge, because basically instead of waiting the whole year for the benefits to kick in, you can just wait 6 months, and then the rest is covered right away. So yeah, this is it for today. Again, thank you very much for watching this video until the end. If you have a question or comment, go ahead and type it in the comments, under this video, and I will respond. If you need help selecting a health plan in the Covered California, I'll be glad to assist. Again, I am a certified insurance agent with them, and I can certainly advise, help you select the plan, or help you with anything that's related with Covered California. I've been with them since the very beginning, so I know pretty much everything. Anyways, thank you for watching, and please stay with us. Thank you.